former Fulton County District Attorney and Sheriff.
Formerly a judge, and he knows a little bit about how these things go.
From Mohawk Valley, legal eagle, lawman.
He is the Sheriff of Fulton County, New York. Just such an amazing guy.
This is the Rich Giardino Show, where the Constitution, crime, and politics meet.
Hey, thank you for joining us. We got a great show. This is a update from last year when we had Sara Boerenko, the Montgomery County Community Services and Mental Hygiene Director, I should say. And she's joining us, and we're going to talk about some of the seasonal stressors and the end of the year and the beginning of the new year stressors and how to handle those. We're at that period between Christmas and the end of the year, or between Thanksgiving and the end of the year. We have Hanukkah, we have holidays. We've had a lot of chaotic things going around the country, a lot of uncertainty in some areas. But and people get together, and sometimes it's stressful for families when they get together because there's so many different political or religious views and things. So without any further ado, I want to thank Sara Boerenko for being with us today. Good day, Sara. How are you?
Good, Sheriff Giardino. Thank you. Good to see you. So happy to be here this year with you again.
Yeah, I appreciate you coming on because people don't realize there's so much that goes on, especially at the end of the year. Once we change that clock and it's dark in the morning and dark when you get home from work, you know, you finish eating and it feels like 10 o'clock instead of 6 o'clock. And everybody wants to, you know, snuggle up, turn the fireplace on if you have a fake one like me, and just, you know, go to bed early. But tell us, why is it so stressful between, you know, before Thanksgiving until the new year? Why do we have, is it that everyone's rushing around, or what are some of the reasons?
Sure. I think, you know, the holiday season starting with Thanksgiving, especially this year, it was so late. So Thanksgiving was literally the last Thursday of the month this year. So it really shortened up the time between Thanksgiving and Christmas when people are ramping up and gearing up for their holidays. But I think there's this pressure for everybody to make Thanksgiving, Christmas, New Year's, and I'll even talk about, you know, like Valentine's Day, St. Patrick's Day, right straight through to Mother's Day and Father's Day. It's always a lot of pressure to make holidays perfect and magical. And when you have little ones at home, or you're at a point in your life where you're starting a family and new traditions, there's a lot of change. There can be a lot of chaos. But I think when we're looking from Thanksgiving to Christmas, we didn't even have a full month this year to really get ourselves together. So it adds a lot of additional stress and pressure on people. And then the time change, you're right. I get up in the morning, I get to work, my headlights are on. I leave at the end of the day, getting ready to go home. I have to put my headlights on. It's dark getting in my house, fumbling with the keys. And I think that the weather, and I will say we had an early snowstorm this year. I mean, our kids in Montgomery and Fulton County already have had a snow day and a 2-hour delay. And I think for the kids, that's great and wonderful. But for parents, we are stressed to the max now with Thanksgiving, Christmas, New Year's coming up, 2 full weeks off of school for Christmas break. And then you throw a snow day and a 2-hour delay in there. I mean, who wouldn't be stressed about schedule, right? Your actual maintenance of a schedule and a daily agenda.
And then I think the other thing that compounds it is you've got young couples who've gotten engaged over the year, gotten married, had their first baby, and there's first celebration, and splitting the families where they might go to each other's in-law. They might go to the in-laws for breakfast or brunch, or host it and go somewhere else for dinner. It's a lot of stress that way. The other thing is it's also a time of kind of renewal, but also a sad time for some people who've lost their spouses, lost a child, lost a grandparent. And so this is like the first holiday for many people where somebody who has been there their whole life is not there. And those add additional stressors. So how do we, as we prepare to close up one year and start another one, it's almost like our bodies and our minds are like, we really do look at it as, okay, December 31st, you know, happy New Year's Eve, and we're going to celebrate New Year's, and we all hope for New Year's resolutions and a better a better year, and it's been a chaotic year politically, and there's been a lot of division, and sadly, and since, between Thanksgiving and the end of the year already, at this point in the year, we've had a lot of shootings, a lot of bizarre crimes that just add to things. It takes a toll on all ends of it. Why a lot of the first should be enjoyable, the first baby, the first Christmas, the first time you're hosting Thanksgiving or Christmas, those should be enjoyable times, but it comes with the stress of preparing, getting it right, wanting to be perfect. So what are the do's and don'ts of the holiday season for families and friends that want to be together, but don't want to have it evolve into, a lot of times I know it's like with us Italians, with Italians, I say, it's not a true Thanksgiving or Christmas unless somebody's getting mad at somebody else over some slight that happened 15 years ago.
Right. Yeah. Well, I think, I always talk to people about expectations and having honest, realistic expectations with yourself. So if you know you are not the person that can make the turkey or you can make the main dish, asking for help. Especially on that first year, because you don't know how things are going to go. I always think about, and I've shared this with you before, in 2016, I had my son in August, and then December of 2016, on December 15th, my grandfather passed away 10 days before Christmas, and I had a new baby. And so, we were at the funeral home on the 23rd of December, and people were sending poinsettias, and they were sending these Christmas cookie platters to my family. And it took two things that should never go together and put them together. And for me, I've always thought about that going forward, and I say that because of those realistic, honest expectations with myself, and never allowing the true meaning of why my family is together or why families should be together to be overshadowed by the symbolism. And I think we do that a lot. So when we're talking about a new family being together or combining families that have never met, just really keeping things simplistic and manageable. It's not the time to try out a new recipe that you've never made before. It's not time to, on Christmas Eve is not the time to hang up the Christmas lights. Even if you are Clark Griswold, do not climb on the roof on Christmas Eve and start hanging those Christmas lights up. If you don't do it, you don't do it. It's really okay. But I think that stress that people feel turns into things that you and I have talked about for years now. Alcohol abuse, substance abuse, domestic violence. It can even lead to suicide. And so when we think about our families being together in those hot button topics that we always want to stay away from, right? Religion and politics are two things that people love to talk about because they know it's going to initiate that reaction from people, but it also impacts the people around them. And it doesn't make the scene and the scenarios in the houses comfortable for the kids. And if you have little ones in the house, right, celebrate those little ones. Don't make it about your political views or your religious views. Make it really about the children and keeping them happy and seeing those smiling faces, because that is what takes stress off of parents and grandparents and aunts and uncles and everybody in that situation who's going to feel the stress that is being put on to everybody else. We do it to ourselves, and it's being able to say, I'm going to give myself permission to not do this year. I'm not doing it.
And it's interesting because my friends and I were talking the other day about traditions that we miss, and probably 15, 20 years ago, I used to dress up as Santa Claus every Christmas Eve, and I'd go to 8 or 10 houses of friends. And I remember one time I slipped in the walkway going to the house. My beard was crooked. The glasses were crooked. Had the whole full costume on. Door opens up. And my friend says, Santa Claus is here. Who is this? And his daughter, who was probably 10 or 12, says, Dad, it's Uncle Rich. It's Uncle Rich. But I was so disheveled. I felt like Santa Claus, the homeless Santa Claus or something, I mean, I was beat up from just falling, but those days go by, and I think one thing people can do is take the videotapes, make a short video of the kids opening the gifts, or the happy times, or, saying a prayer if you say a prayer with the meal, or just having some memories. But I think we don't preserve. I mean, everyone's got cameras and everyone takes a lot of pictures, but sometimes we don't preserve the happiest moments that we should, that'll bring those pleasure. And tell us what your role is as a community services, public health and what is it? Nope, let me get this.
It's okay.
Health director.
Yes.
And it's a twofold position, two positions folded into one. And the state mandates these positions in every county.
Yep. So every county, all 57 counties, and then the 5 boroughs of New York City, it is a New York State statute as per mental hygiene law that every county has a mental hygiene director or director of community services, as well as a public health director. So in Montgomery County, I am fortunate enough to wear both hats because of the way our government here is structured. But we see that public health and mental health go together a lot. And I think you would agree, Sheriff, that when you think about things like substance use, right? So substance use is a mental health issue that we tackle typically, but substance use also has public health implications. So somebody who is a chronic alcoholic, somebody who consumes alcohol on a regular basis, they could suffer from cirrhosis of the liver, which then becomes a public health crisis. Or you also know from working in corrections for a majority of your career that a lot of your inmates, a lot of folks who are in jail who have mental illness, schizophrenia, they smoke. So schizophrenia and smoking go together. We know depression and obesity go together. We know anxiety and overeating go together, or anxiety and eating disorders, being underweight, go together. So for us here in Montgomery County, when we're looking at our folks who struggle with mental health issues, we also have to treat them holistically from a public health perspective as well. So we work with our patients who are in the mental health system to also start taking better care of themselves physically. And sometimes that's getting them connected to walking programs, helping them to quit smoking, even getting them better on a better diabetes management plan. We have lots of programs that work together. My favorite one that works together, though, is our developmental program for mental health first aid. So crisis mental health. So, being in crisis management for your career, when you have a disaster in your county, whether it's a flood, an accident, some kind of disaster that impacts your community, it affects the folks that you're working with, their mental well-being, as well as their physical well-being. So if you were to have, and you don't have one in Fulton County, but if you were to have a train derailment like we did here in Montgomery County, that was a place where public health stepped in to assist with patient care, to assist with the management of the disaster, getting patients to where they needed to be. But then we also stepped in as a mental health department to help folks who were impacted by that trauma and by that disaster. So we helped, in our department twofold on that. And we're fortunate enough in Montgomery County that we do that. And I get to oversee that. But yes, we are, mental health and public health are two mandated departments that every county in New York State is mandated to have.
And like you said, it's interconnected, co-occurring disorders, alcoholism, substance abuse, mental health. And one of the things that our system doesn't do well enough is we almost make some individuals make a choice. Well, you got to go to the alcohol treatment first. You got to go to the mental health treatment first. And it's not as integrated as it should be. But we got to just take a quick break. You're listening to the Rich Giardino Show, where you can subscribe, share, and like on YouTube, Apple, Spotify, Facebook. And today's guest is Sara Boerenko, the Director of Health for Montgomery County, New York, which is in upstate New York, next door to our home county, Fulton County. Sara has been at the job and is full service director, treating both mental hygiene and physical and other public health issues that her county and our communities deal with. Sara, I was on a Zoom call the other day with New York City, and in the Zoom call there was 20 of us, and 16 were from New York City, lawyers, judges, prosecutors. I was the only sheriff, and there was 3 of us or 4 of us from upstate. And one of the problems is in New York City, you can get there by subway or train or cab. Upstate, we don't have enough treatment resources. We don't have enough inpatient beds, and transportation is a hindrance. If you don't have a license of a DWI or if you don't have a vehicle because you don't have a job and you can't afford one, you can't get from the outskirts of Montgomery or Fulton County to the city or to where there's treatment. So that's always a big hurdle for us in rural counties. And I think the people downstate don't understand that. They were talking about all these feel-good reentry programs. And one thing I thought was a little unusual is they were paying people who were getting out of jail or out of prison. One of the programs pays people to go to their counseling sessions. And I was like, boy, that's a little odd. The incentive should be that these people want to get well. And if they're just going to check a box and get some cash, that's not really the focus of what motivates them. If it's the money motivating them, I understand the logic behind trying to bring them into treatment. But I think that it's not a true, they say a lot, you got to hit rock bottom to want help. I don't think you have to hit rock bottom, but I don't think paying people to come into treatment is a good thing. In Fulton and Montgomery County have similar hurdles and lack of resources. It's interesting, the dynamics, because Montgomery County and Fulton have a huge disparity in revenue. You have the thruway, which is a lot of sales tax for gas and fuel. You have a lot of the stores on the main 30 and things. We have stores. We don't have as many stores. We don't have the thruway. So you guys have millions of dollars more in revenue a year than we have. So for us to have programs, a lot of it falls on the local property taxes. And for you in Montgomery County, you do have more discretionary funds from the sales tax, from the more stores, and the sales tax, and especially the fuel tax. Because if tractor trailers are going cross country or going through New York and they stop, I mean, you're talking, I'm telling you, millions of dollars difference because of the taxes. And so then you can provide programs without hitting the taxpayers or property tax. And that makes a difference because, again, that's a stressor on families. Where am I going to pay extra, towards taxes? Because we want more services, but it becomes a situation where they say, yeah, I want services, but why do I want to pay for services for someone else if it doesn't affect me? Right. Unfortunately, and you and I know this because of our jobs, that mental health, substance abuse, depression hits everyone's family at some point in time, whether it's an aunt, a cousin, a son, a nephew. It hits a parent, and we don't realize it. Sometimes we don't realize it because they hide it. They hide their substance abuse problem, or they may take drugs and nobody in the family is aware of it. What are some of the things we should be doing to do a new break into 2026? Like how do we focus on, we always say we have New Year's resolutions and they don't last long. But what are, like you said, eating better, trying to lose weight, but a lot of that are message driven by the public health. But what are some of the things that we should do for ourselves and our family to have a better 2026? How do we stay focused on the positive?
Sure. So I always say everybody that makes a New Year's resolution, their resolution is to be over by January 5th. Most people have stopped doing their resolutions by January 5th because they're just not attainable. So if you're saying to me, I'm January 1, I'm going to get up and I'm going to go to the gym. Okay, that's great. So you go to the gym and you spend about 20 minutes driving around the parking lot trying to find a parking spot because everybody is going to the gym on January 1st, right? Mm-hmm. And then you're mad and you're frustrated before you even get in the gym that you just spent all this time looking for a parking spot, and then you get in there and there's no equipment available. You may not know what to do. Mm-hmm. So I always tell people, do not make a New Year's resolution that this is the year on January 1st that you're going to start going to the gym, because you're setting yourself up for failure. So what I tell people to do is the simplest thing to do as a New Year's resolution or to change 2026 is to start making now a to-do list. So I will even show you. I have a little book here that I keep, and it does have the Montgomery County logo on the front, Montgomery County, New York. But this is my 2026 to-do list. It's all here. And what I've been doing all month long is writing myself little notes in here, things that I have to do, making sure I get on the Sheriff Giardino Show next November. So planning ahead now, right? Making sure I call my son's doctor to get his physical. So I make a to-do list of the things that I need to accomplish for the upcoming 2026 year, because it's attainable and it's realistic and it's things that will keep me organized and help alleviate some of that stress. And I keep this in my purse. Some people have it on their cell phone. If you have your cell phone, you can go on your app and make yourself a notes. If you're very tech savvy, go and put your to-do list on your cell phone. Something that's going to work for you. My husband has a calendar next to where he puts his stuff, on the counter at the house, and his to-do list is there, the things that he needs to do. Wherever it's going to work for you, make it work for you, but keep it small. Don't put on your to-do list that you're going to, clean out your entire attic in a weekend, because that's not going to happen. You may want to say, okay, when I get home today, every Monday, I'm going to come home and that's the day that I'm going to vacuum the living room. And you vacuum the living room, or what it is. Start small, because I think what people do is we try and make things big and grand, and we start going to the gym and we eat a salad for lunch, and then we get on the scale and we haven't lost weight, so we give up, right? Or we quit smoking, but then we smell that cigarette in the morning with the cup of coffee, and we're at work and we smell somebody smoking outside, and we inhale our coffee, and then we're going to Stewart's and buying a pack of smokes, right? And now that's done. So it's really figuring out, how can I make things realistic and what is attainable? And if my goal is to save money, if my goal is to get into mental health treatment, then the first thing I need to do is I need to make a phone call, and I need to understand that I'm probably going to have to wait a little bit for those services. And I need to also find a therapist that works for me. And I was mad at myself that I didn't say this last year, so I'm going to make sure I say it this year. People fail at therapy. And when we ask them why they fail at therapy, they will say it's because I didn't connect with my therapist. And so I always tell people, when you are looking for a therapist, it is literally like shopping for a spouse, a partner, right? It's somebody that you're very comfortable with. Not every therapist is made for every person. And if I go to a treatment facility and they assign me a therapist and I'm not comfortable talking to him or her, I need to be able to go to somebody and say, you know what, I know that I'm probably going to have to wait to get back into treatment, but I need somebody that really understands me and that feels, feels like I can connect with, and this isn't working. It's an interview process. And so I don't want people to fail at going to therapy. I don't want them to drop out because they didn't have a good experience. I want them to stick with it. So, but that starts with finding the right therapist for you, so that that person can help you as a person that you are, know you. And I know I said that a lot, but it's so true. It's really making that connection with the person that you are going to be trusting with your, your thoughts and your recovery and your life and your mental health. And I think it's really important that we do that. But starting small, putting down on a piece of paper, pick up the phone and call a therapist.
I think you're right about that. I think because if you're not going to engage or not comfortable, you're not going to open up. You're not going to be receptive to their ideas, and it's going to be looking at your watch. Is it time to go? I had my half hour or my hour. Unfortunately, we don't have as many options as other places.
Nope.
But it's things we can work on. And I want to touch one of the things I want to do this year. I'm going to talk to my public health and my coroner, my medical professionals. I want to do a dashboard computer thing on our website, where when we have suicides or drug overdoses, we don't list the name. We might put the age and some, we've lost another, female or male at such and such to drug overdose or to a suicide, because people don't realize the magnitude of the of those deaths and the consequences. And I think that if they realize that it's fairly common, it takes the stigma out of it and makes it easier to get help. In fact, there's been a movement across the country where more people are saying lost their battle with drug addiction or lost their battle with substance abuse or lost their battle with mental health in the obituaries. And I don't think that that's a bad thing. I think that's a good thing because they're letting people know that there's a consequence and it affects a family, you know, and they're not hiding it like they might have done in the old days, you know.
Absolutely.
Yeah, one of the things I like to say is, you know, take advantage of the people who give you opportunities. Take advantage of the opportunities that people give you. Don't take advantage of the people who give you opportunities, because so many people mistake your kindness or compassion as weakness, and they try to get what they can get out of the relationship, whether it's money, whether it's connections, rather than get the help that you're offering or the assistance.
100%. And I think, Sheriff, something you hit on made me think of something else. We also have to understand that the help we have or that we're willing to give somebody might not be the help that they need. So I always tell people all the time, people will say to me, oh, this kid needs a therapist. They need to get into therapy. They need to get on meds. And I'll say to them, have you asked the child if they want to get into therapy? Do they want to talk to a therapist, or do they want to get into a group activity? You know, our schools are wonderful resources for adolescents and children to get connected to services that are mental health related without them even knowing they're mental health related.
Gotcha.
And adults, we have the same thing. You know, we here at the county in my department, I have what I call like a sunshine day. So every year on a staff's birthday, we celebrate that person and we do something special for her. I have an all department of women, so I'm not appropriate pronouns. I only have women in my department at this point in time. So what we'll do is I'll say, you know, hey, Sally, your birthday is tomorrow. What would you like us all to do for your birthday? And sometimes it's as silly as, it'd be really great if everybody wore a yellow shirt. Yellow is my favorite color. That means so much to people. And so I think we can integrate those things into workplaces. We can integrate them into our friends, into connections that we have. Mental health and mental wellness doesn't have to be Sarah going to Rich's office and laying on the couch every week for an hour till death do us part, talking about how does that make me feel? You know, we need to stop thinking of therapy and mental health as going into a therapist's office and talking forever and ever about my feelings. Sometimes it's not about my feelings. It's about getting something done to make me feel better. And so that's one thing in my own department here I've implemented. So this year on my birthday, it was December 5th. I won't tell anybody, and you don't tell anybody, but I share a birthday with Walt Disney. You know, I said to the girls, asked me, they said, what do you want to do for your birthday? I said, I want us all to eat lunch together. We all take lunch at different times, and we never really sit down together in one place and eat lunch together. And I said, that's all I want. I don't want anything else. I just want us all to sit down in the conference room and eat lunch together for a half an hour. And we did it. And it was a great day. So we can implement those things with our families, our friends. You know, if you have a mom that you know who is struggling this time of year because everything is so chaotic, show up to the house with a cup of tea, right? Bring her a cup of coffee from Stewart's, you know, send dinner to her house, have it Uber Eat it or whatever it is, whatever the thing is, DoorDash. have something delivered to her. But mental health does not have to happen in a therapist's office. It happens right here in my department. My son's school, I do things all year long that are mental health related for his class that he has no idea are mental health related. And the other parents will say to me, oh my goodness, so-and-so came home with that flyer that you gave to the teacher, or he came home with a stress ball and a pencil that said, you are amazing. And I said, yeah, that's mental health at work. It doesn't have to be huge. It just has to be.
Well, we talk more and more about wellness, and we know veterans, active duty, we know fire, EMS, and police have more police officers die annually from suicide than they do from getting shot by a perpetrator. And I want to make a plug here that the New York State Sheriff's Association is developing a wellness camp with counselors for public safety, fire, EMS, and law enforcement across the state. And it's in Cayuga County, Cayuga Lake, and we do 2 months in the summer. We do the kids camp. And so we decided we're going to do more. And we're looking for funding for the Institute, the New York State Sheriff's Institute, which is doing the project. And when we open up, it's going to be open not only to deputy sheriffs, but to everyone. And so that we there's certain restrictions. Like if we tell a certified counselor something, depending on what it is, they're a mandated reporter.
Yes.
But some counselors fall outside of that. And if you're a police officer or a firefighter or a veteran, you don't want to give up your rights. You don't want to give up your handgun. You don't want to give up your authority. You don't want to lose your job. So they keep things inside, and that doesn't help anybody. So the New York State Sheriff's Institute is in the process of, and you can go online and see it, on developing a wellness center for the statewide for all first responders. And it'll be an excellent thing when we're done. And so I wanted to just plug that, but we see too much and that is out of our control, and a lot of people don't want to get involved. So again, I think you see something, say something, and don't assume your friend is we all hear it's not even worth living anymore. No, and you know what, 99% of the time they're just blowing off steam and they don't mean it, but that 1%, and then you, the survivor, feels guilty because maybe I should have seen the signs or done something or said something. So I want to thank you very much. Is there anything else I missed that you think is important that we should mention to our listeners?
No, I just think, like you said, if you see something, say something. And I just want to give your listeners a hotline phone number. The local Montgomery and Fulton County hotline number is 518-842-9111. 842-9111. And that is answered 24 hours a day, 365 days a year by a licensed clinician who can connect you to resources and talk to you in real time and help you get through what you're going through, whether it's a suicide attempt, suicide ideations, drug use, drug overdose. 842-9111. And Merry Christmas, Sheriff. I can't wait to see you again next year.
Merry Christmas. Hopefully we'll see each other before that. If I get this program off the ground that I want to do that highlights not only the losses, but what we can do. The New York paper, New York Post, if somebody commits suicide, they say, here's the hotlines. You can call these if you're having mental health issues and struggles. And I want to make that go hand in hand so people know that it's okay to ask for help. It's a sad thing. But listen, have a great holiday. Thank you for being with us again. You've been listening to the Rich Giardino Show with Sara Boerenko, the Montgomery County Health Director. And we've done this last year. We're doing it this year for you. We hope you like some of these tips. Please share, like, and subscribe on YouTube, Spotify, Apple, Facebook, and a lot of other premium platforms. Thank you very much. Thank you for listening to our program. Again, Sara was with us. Excellent program. A lot of good tips for people, especially at the chaotic times between Thanksgiving and New Year's. A lot of good tips for starting next year. Don't have a big resolution. Make some simple things you can complete, and don't make it for the first couple of weeks of the year, but across the whole year. Again, thank you very much for listening.
Like and subscribe to The Rich Giardino Show, part of the Elite Influencer Network, wherever you get your podcasts. And we'll see you next time on The Rich Giardino Show, where the Constitution, crime, and politics meet.